Welcome to Health World Peace. Uncovering multiple myeloma, the hidden blood cancer. As we age, it is common to experience persistent pain in the lower back, neck, and waist that does not improve with medication. Even after visiting orthopedic specialists or pain clinics and undergoing X-ray examinations, no abnormalities may be found. Furthermore, unexpected fractures, such as compression fractures, may occur without any specific cause. Even expensive magnetic resonance imaging, MRI, scans might not reveal the underlying issue. In such cases, it is necessary to consider the possibility of multiple myeloma and seek help from a hematologist rather than an orthopedic specialist. March 30th is International Myeloma Day. Multiple myeloma is a disease in which a type of white blood cell called plasma cells, responsible for the immune system, proliferate abnormally. Abnormal plasma cells invade the bone marrow, damaging bones and kidneys and reducing the number of white blood cells and red blood cells. This increases the patient's risk of infection and bleeding. Ranked among the top 3 blood cancers alongside leukemia and lymphoma, multiple myeloma is more likely to occur as we age. According to a 2020 study by the National Cancer Information Center, the incidence rate of multiple myeloma was 10.7 per 100,000 people, accounting for 0.6% of all cancers. While it rarely occurs at a young age, the incidence rate increases from the 40s and is most common in the 70s. Radiation, pesticides, benzene, and genetics are suspected causes, but the exact factors have not yet been identified. Multiple myeloma often presents with bone pain, weakness, and fractures, making it difficult for patients to realize they have cancer. Pain commonly occurs in the lower back, ribs, and hip joints and may lead to fractures. Anemia, kidney dysfunction, and hypercalcemia, a condition in which calcium does not remain in the bones and instead enters the bloodstream, can also occur. In particular, a compression fracture of the spine could be a symptom of multiple myeloma. This is often mistaken for a simple injury. In such cases, it is important to exercise caution, as a non-hematology department may only be able to perform tests and treatments for spinal fractures. Left untreated, multiple myeloma can worsen, leading to fractures in the spine, arms, and legs, and even chronic kidney failure, which may require dialysis. Experts say, it is important to detect multiple myeloma early through regular checkups, as the disease does not present typical symptoms in its initial stages. They add, if you experience abnormal fractures or persistent bone pain, it is a good idea to visit a hematologist for an accurate examination. The basic treatment for multiple myeloma is immunotherapy. Although cell cytotoxic chemotherapy used to be the mainstay, a combination of various targeted therapies and immunotherapies is now used. Autologous stem cell transplantation is also a treatment option. High-dose chemotherapy is used to treat damaged bone marrow, and the patient's own hematopoietic stem cells are collected in advance and transplanted. Hematopoietic stem cells, which are produced in the bone marrow, create various blood cells, such as white blood cells, red blood cells, and platelets. This treatment method can be selectively used depending on the patient's age and condition. New treatments for multiple myeloma are being actively developed. Multiple myeloma has a complex mechanism of development, making it difficult to achieve a cure with targeted therapies alone. Various mutations can arise as the tumor progresses, leading to drug resistance. CAR T-cell therapy, which involves genetically engineering immune cells to express a chimeric antigen receptor targeting cancer cells, has been approved for use in South Korea. Experts say, while multiple myeloma is not easy to treat, new therapies are being developed rapidly and used in clinical practice. In 2021, the CAR T-cell therapy Kymriah was approved, greatly benefiting patients with malignant lymphoma and acute lymphoblastic leukemia. The expert added, recently, the multiple myeloma CAR T-cell therapy Kavkiti has been approved, which is expected to greatly help in the treatment of relapsed and refractory multiple myeloma patients. Thanks for watching.